Very excited this morning to be able to introduce Max Cage and Ken Oropesa from the ASPCA, here to tell us about how the ASPCA teaches old iPhones new tricks.
Hello, everybody. Sorry, I forgot I was mic'd up. I'm glad that the JNUC gave us the coveted 9 a.m. Thursday morning time slot. This is our first JNUC. We've only been using Jamf for under a year, a little less than a year. This is our first time coming to the conference. My name is Max. This is Ken.
How you doing?
And when we first brought in Jamf, Ken dove in and really kind of absorbed. And then his first request was, can we go to JNUC next year? And I brought the request to my boss, who cuts the checks. And she said, sure, you can go, but you have to go with him. Make sure he gets as much out of it as possible. I said, all right, yeah. She said, but you also have to try to present. If you present, you can go. So I filled out the application, and I sent it off. And I realized I wasn't very worried because my boss is kind of a softie. And I figured even if we get rejected, she'll probably still let us go. But we got accepted, and now we're here, which is a little scary. But it's also pretty cool because we get to tell you how, as rookies, just starting to use the software, we got a lot out of it very, very quickly. Really made an impact on our procedures. So this is us, Max and Ken, and we are from the ASPCA, which is the American Society for the Prevention of Cruelty to Animals. It is not ASPCA. We get that a lot. So the American Society for the Prevention of Cruelty to Animals has been around for over 150 years. We're a national organization of almost 1,000 people, and we have our arms in many different places in the animal welfare space. Our staff is largely remote. We have folks that are doing disaster response, working to rescue animals in hurricanes and floods and earthquakes and the volcano in Hawaii. We have people who are working with law enforcement, local, federal, and state levels, to investigate and respond to cruelty cases and neglect cases. And we have people working with legislation, working to change laws to better protect animals. We have many, many different programs, these are just a few of them. So we are more than just a sad commercial. I'm really sorry. It's a really effective commercial, but it kills, I get that. So when we began our journey with Jamf, and we were accepted to do this presentation, we had a bit of a battle, Ken and I, how we were going to do this presentation. I wanted to have lots of pictures of cats and dogs and puppies and people in ASPCA t-shirts, and Ken wanted to go a little more serious. He wanted us to not have memes and do something a little more serious. So we kind of found a middle ground. But I will show you a cool photo. This handsome devil is me when I was working with our field team a year ago, responding to, in North Carolina, we had a massive shelter set up. And the Hurricane Maria had come through and pretty much torn up Puerto Rico and the US Virgin Islands. So this is actually us in action with our field team. So we have a lot of respect for what they do, and we have a lot of involvement in what they do. So this presentation, just to get you a little bit of what we're going to talk about, is the nonprofit challenge, how we as IT and the organization as a whole has to really own that nonprofit challenge. We want to talk a little bit about a use case where we brought Jamf into the picture, and it really sewed together our LA initiative and some of a particular use case of what we were doing in Los Angeles. Then Ken is going to talk to us a little bit about another use case in New York City in our animal hospital, where Jamf kind of took a good idea and made it great. And then we're going to tie it all together with just a little bit of a summary of how we were really able to use Jamf to elevate our game and bring it up. So the nonprofit challenge is all about getting creative. We have to maximize our resources. Our resources are finite. It's all those donor dollars, those ad commercials. We can't just spend money willy-nilly. We have also the resources of our people. They would much rather have their hands in their job working with the animals, whatever their role is, than spending time on the phone with IT, trying to be talked through setting up their phone or doing another IT task. And because our resources are finite, we like to repurpose before we repurchase. We want to reuse a tool, be it a piece of hardware, a piece of software, get as much life out of it, as much effect out of it as we can. And because these folks are remote, they're all over the nation. They are standing in floodwater. They are working in the fields, chasing after animals that need to be rescued, or a million different roles. I keep focusing on that, but a million different roles. They're all over the country. We have to be able to support them remotely and effectively. And Jamf helped us really get to where we feel that we're on our way to be doing that. So I want to first take you to, I went backwards. I want to take you to Los Angeles, our Los Angeles initiative. We're doing a number of things in Los Angeles over the past few years, but I want to focus on a particular use case. We have a footprint in Los Angeles doing community service work, a lot of social service work, in these neighborhoods where there's a real lack of resources for veterinary care. Veterinarians are expensive and few and far between in some of these neighborhoods where we have a presence. So our people, our community engagement workers, are working with the members of the public, and they're in crisis. They have a pet, and they have needs, and they need a lot of help. We have a lot of paperwork that goes with that. So while we're engaging the community, what I'm going to talk about in this use case is going paperless, which was really important for a couple of reasons, and the web clips. Ken put that in there because he really, really likes what he did with the web clips.
What can I say?
So going paperless, just to give you a little bit of background before we get into these bullet points. The community engagement folks working with the members of the community who need help, it's a lot of paperwork. We're giving them vouchers for medical treatments. We're cutting checks. We're giving them animal food when they need it. But there's a lot of paperwork that goes with that. So these community engagement workers, essentially social services workers, they're filling out forms with the members of the public, and they're trying to keep track of these forms all day, these papers, handwritten, in a folder. And throughout the day, they're collecting them, they're working with these people. It's a big distraction filling out these forms. And then at the end of the day, they've got to scan them all into Box. And they're being retrieved by our back office people in one of our offices in Illinois. And that's where the magic has happened. They're the ones opening the cases, entering all the data, cutting checks, issuing vouchers, making all that magic happen. So not only do we want to go paperless because it's a green initiative and it's a good thing to do, but we want to go paperless to cut down on all this wasted time and effort and really make the whole process more effective and efficient. So again, repurpose before repurchase. We probably could have bought some software that was going to help us get where we were going to want it to go. But we wanted to see if we could do it in-house, reuse something we had. We were using Docusign in-house. And Docusign is just what it sounds like. It's a digital document service. We also had Smartsheet, web forms that we could build that would, when filled out, would submit a row into his database. And Civicor, which is a custom database application that we have. But Docusign is what we settled on for this paperless initiative. And we decided we were going to use some iPads. Web links on iPads, that would be great, Docusign. So we took the paper forms and we just scanned them. Scanned the paper form into Docusign, added some fields. Now we can collect text instead of handwriting. This is all great. We wanted to put these on the iPad, so of course, bookmarks. So we needed more than just a bookmark because you can imagine, we've got all these URLs that we're going to walk people through, or do we have them send us the iPads and send them back? Or do we get on the phone with them for an hour, walking them through, entering a URL into Safari and choosing Save to Desktop? And then you got an ocean of these Safari icons on the desktop and tiny little text, and how do you tell them apart? We've got a lot of forms, and each one has multiple languages, English and Spanish. They have to be easy to differentiate. And we have to be able to update them remotely. Every time we add a new form in Docusign, we have to get it on the iPad that the engagement specialists are working with. So we decided to go with the web clip. I told you I was going to bring it back to the web clips. And whoever designed this web clip did a great job. It's gorgeous. It's beautiful. It's got the colors, download a button. But just like having a desktop or home screen full of Safari icons, this is not going to be any better once you have 10 of these on the home screen. You still can't be able to tell them apart, which form is which. So Photoshop came into it, and we gave them a little jazz. We gave them a naming convention, a color coding system. Now we can easily differentiate between the English and the Spanish version. This is Ken. This isn't the Ken form. This is the Kennel form. And then we can put together a configuration profile that would put them all onto the iPad, onto a home screen, give them the same home screen layout. Now, no matter which iPad that this engagement specialist picks up, it's laid out the same way. It looks the same. They know muscle memory kicks in. They know which one they want to hit. And every time we want to add a new document or a new form, we just push it out to that configuration profile, and in a seconds, they get it. And this is an example of how Jamf really took us into a whole new place, took a good idea and made it great. And at the end of the day, it's all about the engagement specialists working with the public. This is Bernice, beautiful woman, working with an actual Los Angelino who actually has an animal in need, and she's got better things to be doing than working with the technology and fighting with the technology. And she can get back to what she's doing. So this is just one of our use cases, an example of how we made a big impact in Los Angeles. Now Ken is going to tell you about New York City and making an impact in another area.
Awesome. Thanks, Max. So as he mentioned, we're a nationwide organization, so we're pretty much everywhere we need to be. Home is generally considered to be New York, and our biggest footprint right now in New York is our 92nd Street location, which is what you see on the screen. So I could probably give a whole presentation on everything we do at 92nd Street, but one department I want to call out in particular is our animal hospital. That's where ours started when I first got into the ASPCA, worked my way into IT, so I had a great perspective in terms of what was necessary, in terms of the challenges and everything else, and how IT could jump in and really make a change for the hospital for the better. So we were talking about changing the landscape. When we say changing the landscape, we wanted to go through, sorry, went a little bit too fast. Easy access to digital resources. So what we mean by that is simply, I want to clock in and clock out from my desk. I don't have to go to a time clock. I don't have a computer at my desk, so I have to go take time out of my day to go there. I want to check my paycheck. I want to just see what's going on, with my pay. Little things like that that the other employees in the organization that have a desk, that have a computer, that's their own, take for granted. But these employees that have hands on animals, sometimes even in them, they're orphans, so they don't have these resources available to them. We wanted to improve communications. So generally in the hospital, what you do is you call an extension, someone picks up, you have your conversation, you go from there. But what happens when you're away from that desk? It's happened to me so many times when I worked at the animal hospital where I would get up, do what I have to do, come back, and it's a missed call, it's a voicemail, and it was something really important. And in the animal hospital, that's time wasted and that's precious time. So we wanted to make sure that we can find a way for these mobile employees to talk to each other in an effective way. We wanted to reduce overhead paging. So we've all been to a hospital where a voice comes on overhead, says something that we don't really understand, it startles us, and then it goes away. So imagine that for an animal. We really wanted to get rid of that. And then, as we said, repurchase before repurpose. We wanted to repurpose old equipment that we had in our stock and find a new home for them. That's where the title comes from. We wanted to teach these old iPhones new tricks. So when we started down this journey, one of the first things we thought about was the application, right? So we were thinking, how are these employees going to talk to each other? First thing we all thought of was iMessage, right? It's reliable, one-to-one, one-to-many, it works. But when we were really thinking about the iPhones, we said, yeah, we could probably just buy data plans for all 200, 300 employees and call it a day, get iMessage and Apple ID, and they'll do what they have to do. But that wasn't cost effective. These employees were generally in a building, our building. They weren't outside, they didn't need cell reception. So we said, instead of doing that, let's just make it Wi-Fi only. Let's just go ahead and save that money and put that somewhere else. So we were able to give these iPhones that were usable to our employees, Wi-Fi only, and go from there. But the main part that I wanted to talk about was the application. So once you take away iMessage, leaves this huge gap of how we're going to talk to each other. And we went through so many different apps. So Slack is there first because I love Slack, and I'm sure you guys are here at this conference. We all know how good Slack is, but it just wasn't cost effective for a nonprofit. It's very expensive. They still, they offer a discount, but it just wasn't going to work, and it wasn't scalable. So this was the animal hospital, but whatever we used there, we wanted to put it everywhere. So if anyone from Slack is watching this, we want to do that, but Yammer. So we're a Office 365 shop. We already had Yammer. We said, okay, if we're not going to do Slack, let's do Yammer. Let's try to figure out what's going on there. We got a lot of poor feedback in terms of the usability on mobile, how hard it was to really talk to each other. It just wasn't going to work. Skype for Business, you already know, it's horrible on mobile. And then Workplace by Facebook. So even though that's the last part there, it doesn't mean that that's where we settled on. We're a flexible shop, and we really wanted to make sure that whatever we did for our employees had that kind of buy-in where they said, okay, we really do like this, we're going to use it. So 4 bullets on that slide was probably, what, 4 or 5 years of iterations in terms of piloting, let's test it, let's get some feedback, okay, that's not the way we're going to go, okay, let's continue, let's go from there, let's try something else. So we're constantly evolving, we're trying to figure out exactly what we're going to use for our employees, but again, we have to be flexible because we're a nonprofit organization, we have to be creative. So as I mentioned earlier, we're going to do Wi-Fi iPhones, right? You get an iPhone. I was already in the animal hospital when IT came and said, hey, we're going to have a whole day where we're going to give you these iPhones, we're going to teach you how to use them, and then they're yours. You can do whatever you want with them. That was great. We got 5Cs, this was a few years ago, and those 5Cs really didn't age well, right? The hardware wasn't up to par, or the new 6Ss and 7s and so on are now. So they were okay, but they really didn't get that kind of buy-in that the IT was looking for. And again, I had that perspective as an animal hospital employee. But they were repurposed, right? So we kind of forced in terms of what we had. Over time, we were going to get better. We were going to get a 5, we were going to get a 6, a 6S. So there was an opportunity there. But we had a good idea, but we didn't have Jamf to make it better at that point. So once Max came around, he looked at everything. He said, we have these huge problems. We have iPhones that really aren't up to par. We have to put apps on them, but we didn't have mobile device managers. We didn't have Apple Business Manager to put these apps on them. So we did Apple IDs. And we all know how horrible that is to have a whole spreadsheet full of Apple IDs. We want to make sure that the employees don't have to fiddle around with another password to remember and reset. So we thought, hey, let's just do one Apple ID for everyone. Not a good idea. It really wasn't. Anytime an iPhone came into the environment, everyone got a notification. Apple, would decide tomorrow, oh, hey, I need your password again for some random reason. That's a call to IT, that's a call to the help desk. So now this solution for the hospital became a little bit more work. It was another challenge for the help desk. So it wasn't clicking, so we have a good idea, but we didn't have something like Jamf to make it better. So once Max came in, he said, let's look at everything. Okay, let's go with Jamf, got approved. He also brought me into it. So it was kind of like a match made in heaven where I loved iOS, I knew it, I wanted to be in IT, I got my opportunity, and I had something like Jamf, brand new, fresh out the box, and I said, this is a match made in heaven, I'm going to dive in. So we went ahead, we customized everything, we did what we needed to do, but the focus, which is a big part of this presentation, is the focus of an animal hospital, of a nonprofit, going in and saying, these are the problems that we have. Instead of opening the box of Jamf and saying, okay, this is a great toy, let's just figure out what we can do with it, we said, no. We're going to look at our problems, and we're going to take a step back and go, okay, let's put some checkboxes there, and we're going to go one by one, and just make sure that everything that we do is focused on those problems at hand. So we got Jamf earlier this year. For 6 months, we were able to do something huge for our animal hospital, and that was the exchange program. So what you're looking at right now is live. That was happening when I had a meeting with Max, something unrelated to iPhones and Jamf and anything else, and I saw my colleague Sinquan there in the white shirt talk to Gary, an animal care technician at the animal hospital. And he has this old iPhone 5C in one hand, new 6S in another. He's showing him how to log in with LDAP authentication. He's then going through the setup, which is immediate because we're skipping all those useless steps. It's going straight to the home screen that has that orange ASPCA logo that we saw earlier. So right now, we're getting a customized experience for him, something that's specific for him. Because LDAP knows his department, it's going to give him specific applications. And then from there, a window's going to pop up that says, hey, we need your password one more time for email. So instead of Sinquan going in and fiddling with Office 365, okay, we'll make the profile, we set it up so it immediately knew, yes, we know his email already, let's just ask for his password, now the mail's set up. So within 2 minutes, he gets an iPhone that's set up, customized for him, and now he sees, oh, I have a lot of emails, I gotta go. That was 2 minutes of his time instead of an hour, and he's an animal care technician, so he needs to go somewhere else. So now he has the time to do whatever he needs. So he has a powerful tool in his hands that was enabled by Jamf, and now we have the time to do other things.
Yeah, you have a lot of time on your hands now. Maybe you could clean that place up.
Yeah, I wasn't thinking when I told you to screenshot that. Yeah. So a little weird segue, but it's something really important to us at the ASPCA. It's called fear-free. So fear-free is a philosophy that we have at the ASPCA and other places do, but in layman's terms, because this, again, could be its own presentation, it's the experience of an animal when they come into our facility. So we've also been to the doctor's office where we hear a strange sound, or we hear something, we see a needle, it freaks us out, we don't like it. But we know we have to go through it. This animal doesn't know that it has to go through that. So we wanted to make that experience better, even though, yes, they have to be here. Yes, we mean well, but this animal doesn't know that. So a stressed animal that's coming in shouldn't be treated like a stressed animal. It should be treated like an animal that just needs a room to be, by himself with his owner, maybe a little string cheese, whatever it's going to take to get that animal a little happy, so that when we do come in with the vaccine, when we come in to take x-rays, he's seeing us as friends and not just employees that need to do something on him. So that fear-free certification, when it came down for the entire organization, we said, wow, we have a great opportunity now to do something with Jamf and make that happen, and that was the overhead paging. So what we did was made sure that when we had the application set up, that way we told our employees, look, instead of paging overhead or calling doctor, now you have this great tool in your hand, you can just text. You can just have a group chat, and you can tell whoever you need to tell, hey, I have an animal that needs to go to room 1. But you're doing that by text. You're not calling someone, breaking that conversation with the owner. That owner's stressed. So anything that can make that relationship better and seamless and also get your job done was going to be huge for us. And that's what Jamf allowed us to do when we did that iPhone program. So less overhead paging meant more happy animals. And I know I want to be very serious, but I couldn't help. I really couldn't help. This is what it looks like when someone is able to get away from the trial and tribulations of IT and technology and can just focus on their job. They just grab a bunch of kittens and pose for a photo. And we're really jealous. And then another picture. This is one department from the ASPCA teaching another. So we're big on continually learning and teaching, even within our organization. So what you see is a bunch of zebras. So we're not really caring for zebras. They're subbing in for probably like a Rottweiler or something. But these are the zebras that are subbing in for animals that we're going to then train on handling. So we're going to put a blanket over them so they can feel protected while we do something else on their leg or their arm or anything like that. So what you don't see there are these iPhones, again. So everyone there has those iPhones that we set up for them. So after this presentation, they're going to go ahead and take notes. They're going to upload something into Box. They're going to have communication in the sense that they're going to talk to each other like, oh, I have this idea. Oh, let's do this next time. Bring it all together. So before Jamf, before this iPhone program, that presentation is where it stood. That one-to-one collaboration wasn't really there. But now everyone feels connected. So something like fear-free can really spread, very wide. And that's how Jamf taught us new tricks as well. So even though on paper, yes, this is just to manage mobile devices, but it's a trickle-down effect, right? We're empowering our employees to do something that they couldn't before, and we're doing it in a seamless way where they can just cut out the clutter, go to the application that they need, it's customized for them, and they can move on. When we approached Jamf, we had that problem-solving technique that I mentioned earlier. We went and we put checkboxes to the problems that we already knew existed and said, let's solve them one by one. Now, thankfully, we've solved many of those problems, and now we have time to look and think, okay, what are the good ideas that we want to do? So earlier we were talking about Jamf setup and reset. That's huge for us. A lot of shared devices. We could put an iPad somewhere in our ICU. I'm early shift, I get this app. I'm late shift, I get that app. Huge for us. So now we have the time to be creative. But in the beginning, we just needed to solve these problems, but we had a laser focus, and it was huge. But as a nonprofit, that's necessary. And we maximize our resources. So instead of having 10 of our help desk employees all diving into Jamf and trying to play around with it, we had that focus. So we had 1 or 2 employees, but that's all we needed because they were focusing at the problems at hand. And when we talk about maximizing resources and doing something for our employees, we're talking about improving lives. We're talking about a tool that, when used correctly, can make a difference. So again, Jamf is mobile devices, but that trickle-down effect means happy animals, happy lives.
That's
great.
it?
Yeah, that's it, man. That's it. So thank you so much for coming. I know this slot was weird. Everyone probably wanted to go sleep a little bit more, but really thank you.
We have a question. Yes. The list of the apps that he went through was the iterations of things we were testing, and currently we're using Workplace by Facebook. It's going to be something that our internal comms people are replacing our old antiquated intranet system with. So we settled on that because it's got a great mobile app. It may not be the thing we end up settling on, but it's currently what we're using now for the texting.
Yeah,
it's a challenge.
Yeah, and that's what we were talking about, that it's a continuing process. to try to figure out exactly what's going to work. You know, there's a billion chat apps in the App Store. Doesn't mean that our employees are going to like it. So we just really have to keep creative, being creative. But yeah, and then a little surprise for you, Max. There's your cat meme.
Oh, I got my cat meme.
There you go. Yeah, but for real, thank you so much, everyone.
Yes?
What was the process when you took paper forms to Docusign? Like, is it they just press a submit button, it goes to a database somewhere? I think you mentioned like you had a database program. Like, was that something you had and you leveraged, or you looked into and bought, and how hard was that to do?
So Docusign is something that we were already using in the environment. So to get that Docusign form as a digital form, we actually just did a scan of the form, dropped in the fillable fields and little, we don't actually work on the Docusign backend, one of our other teammates does, but configures it so that it takes the digital signature and then it saves that as a PDF to a box folder. So that box folder is where the back office employees are pulling the scans down from, the PDFs down from, and then they're processing them, doing different things with them so that they can get the cases opened.
Yeah, I used that at the animal hospital when we would have like elderly clients that wouldn't be able to come in. So we would send them that because on the phone, you're not really signing it, you're just typing your name, it creates a signature. And it was sufficient for us, from our legal department, to accept that as a signature. So what happens is we set it up, we design it like you saw in that screenshot where you're just dropping in a box and it says full text here. And it's very easy, it's just drag and drop. Once you complete that, that's called a template. And then from there, you can set who it goes to. So you can set one email address or many. So once the person decides to submit, that automatically gets emailed to wherever you set. We have it set up to a box folder so that that box folder takes those emails and says, okay, now I have a new file because that's what was attached. And then our back office processes them one by one. So it's pretty cool.
Hey, how's it going, guys? I have a couple questions for you guys. One, what does procurement for devices look like, you guys, as far as purchasing? And then also, what does support look like for those users in the field, you know, if they get like a cracked screen, water damage, something like that?
So with our iPhones, being a nonprofit, one of the benefits of being a nonprofit is we have a really good deal with Verizon. So with the phones that we can get for the 1-year contract for most corporate places, it's like a 2-year contract. For us, it's a 1-year contract. And they've got a fairly decent class of phone that we get for that $1 renewal. So the phones, we were able to aggressively, when we needed to build up this cache of phones to begin this phone program with the animal hospital, we were able to fairly aggressively go out to the employees that had phones on these contracts with Verizon and say, hey, you're eligible for an upgrade. Can we get that into your hands so we can get your old phone back, build up that cache of phones? Then we were able to then take them and redeploy them with the first iteration of what became the current phone program. As far as managing the cracked screens and so on, some of that comes out of that cache of phones that we have. Someone in the field has a cracked screen. We can ship them the new phone from our cache of phones and have them walk them through swapping the SIMs, and as soon as it comes up, Jamf pushes down the profile, makes it a beautiful thing. Or they may be close enough to that end date on the renewal date on their Verizon contract that we can just have the new phone shipped to them. And again, it's coming pre-DEP, pre-staged. They just turn it on and it brings up the screen for their login, and the Jamf configuration rolls in.
So when you were describing it right there, it sounds like you're getting away from Wi-Fi only now again, or is that still in play?
So the Wi-Fi only is really that use case in the animal hospital because they're all in that building that has really good Wi-Fi. The folks that I'm talking about is, again, this is just the animal hospital is just one small piece of our organization. So we've got the field responders, they all have mobile phones, and the lobbyists in DC all have mobile phones. So we've got different pockets of the organization that have the mobile phones, that have the Verizon contracts. Those are the ones where we're encouraging them to upgrade when they get that $1 renewal so we can get the old phone back, and then we take that to the other use case, which is the animal hospital, where they're using the Wi-Fi phones. Yeah. So they're using the old hardware on Wi-Fi. Again, repurpose instead of repurchase, trying to do it as squeeze every cent out of that dollar. Do we have any other questions? You can ask about the Red Sox game if you want.
Yeah. I told him not to say that, but he just
had
had to. Yeah.
throw them under the bus. Any questions about the ASPCA that you want to ask? That it doesn't have to be technology related? Anything?
Is
'Cause
Sarah
we
McLaughlin
kind of went really
coming?
fast.
Is she coming for the?
She's backstage.
Okay,
She's
I'll
going to
go
make
back.
you all cry. All right, if there's no other questions, thank you very much for coming early on a Thursday morning. A couple of Jamf rookies sweating nervously up here in front of you. Thank you very much. We really, really appreciate it.
Thank you. Thank you.